So now let's start with your journey, right? Let's start with your journey. Now, there was a point in time that you started thinking of what? Becoming a nurse, right? Can you
Yes.
see my screen?
Yes, I could see it.
All right, sound good. Now, there was a point in time you were thinking of what? Becoming a nurse. Now, in
Yes.
order to fulfill that need, you needed what? A nursing school program.
Yes. Yes.
Now, after the nursing school program, you have to take what? The NCLEX exam in order
Yes.
to what? Be
Become a
that nurse,
nurse.
right?
Mm-hmm.
That you were thinking of.
Mm-hmm.
Now, I wish you to tell students this. You need two things to become a nurse. One, your nursing school program, and two, the NCLEX. Together, you then achieve what? Becoming a
A
nurse,
nurse.
be it a
Mm-hmm.
registered nurse or a licensed practical or vocational nurse. Right.
Yes.
So, but with you, you are done with the thinking, you are done with nursing school. Now, what is stopping you right now from becoming the nurse you want to be is what? The NCLEX. And this
Mm-hmm.
is what we want to do, passing the NCLEX together. Now,
Right.
I want to give you a clear understanding of what nursing school look like and what the NCLEX look like, because a
Right.
lot of students have not transitioned to the aspect of what thinking like the NCLEX, right?
Right.
So now nursing school, right? Nursing school train you to have all the knowledge you
Mm-hmm.
need in order to pass this exam, which is the NCLEX exam, that will then give you the license to practice as a nurse,
Mm-hmm.
right? So when you finish nursing school, you don't automatically become a nurse, right? You need to show to the NCLEX that you can use this knowledge to what? Practice, and you are a safe nurse. So
Right.
the aspect of the NCLEX is what? Practice and safety. The
Right.
aspect of nursing school is knowledge. Now, NCLEX want you to now utilize that knowledge to show that what you can practice and that you can show that you are a safe nurse. So nursing school exam is strictly what? Knowledge-based exam.
Right.
Why the NCLEX exam is strictly what? Practice and safety-based exam. So
Mm.
when you are thinking, you need to understand this one approach, which is in nursing school, right? In nursing school give you what? All the courses, and at the end of the day, test your knowledge related to what? Each courses.
Right.
But on the other hand, NCLEX provide you what? 8 client needs and 6 concepts in order to test that you are a safe nurse. So, since we know in nursing school, all we do is courses and then exam, NCLEX as well, to what we do is 8 client need and 6 concepts. So we know our courses, med-surg, pharmacology, pediatrics, maternity, nursing school courses. But the
Mm-hmm.
NCLEX exam, you need to understand the 8 client needs and then the 6 concept. Very important. But if you ask a lot of students, what are the 8 client need? They don't know it. What are the 6 concept? They don't know it. Now, the 8 client need and the 6 concept, right?
Mm-hmm.
There's a document that break them down. That document is called the NCLEX test plan. Do you know about this document, NCLEX test plan?
Yes. That's what
All right.
like management of care, safety,
Yeah,
infection. Okay.
exactly. Right.
Mm-hmm.
It contains everything you need to understand about the exam. Right. So that you can be able to what? Pass the NCLEX exam successfully. Let's try
Right.
to visualize a particular question. Now, take for instance, this is a particular question right here. Right. The first thing that you are looking at or you are trying to figure out when you are trying to answer a particular question is what the question is testing.
Right.
Now, what if I tell you that every NCLEX question everything that you are going to be tested on the exam, it's already on that particular document, the NCLEX test plan. All you just need to do is to figure out the content NCLEX is testing, then understand what the NCLEX examiner is testing, and then be able to answer the question correct. Now, the NCLEX test plan contain the content, right, for the exam. Now, you are taking the NCLEX-RN, right?
Yes.
All right. So the NCLEX-RN will have 146 content. Now, every NCLEX question have 3 parts. We call them the body, the stem, and lastly, the answer keys. Now, this is where you tend to understand the NCLEX better. Now, the body of your question contain this content. The stem, right, contain the examiner question. And then your answer key give you various option for you to select the correct answer. Now, advanced way that I want you to think about this is that your answer key also give you extra understanding to what the body and the stem is telling you. Right. Now, when I see a particular question on the NCLEX exam, the first thing that I think of is this. I ask myself, what is the NCLEX test? Because I understand how the NCLEX work. Because I know NCLEX will arrange the question in form of content, examiner question, and then answer key. That is the 3 part, right? Now, body, stem, answer key. So I'm going to look for the body in that particular question. I'm going to ask myself, what's the examiner test? Because it's not possible, right? If you've gone through the NCLEX test plan, which are what? For the RN, 146 content, it's not possible for you not to find out what the NCLEX is testing, because the whole goal of the NCLEX is not the content. The whole goal of the NCLEX is to find out if you are a safe nurse, testing you through the 6 concepts. Remember, I mentioned something earlier on. I said NCLEX utilize what? The 8 client needs and then the 6 concepts. So the content is not even that important than the 6 concept, because the 6 concept is how the NCLEX tests to see if you are a safe nurse. It's just like right now. NCLEX can just tell you a patient have what? Advanced directive, right? And then the next thing NCLEX might ask you related to one of the concepts might be communication and documentation. Now, let us think about it this way. If a patient have advanced directive and then we fail to communicate and document it, what will happen? There will be a big problem, right?
Yeah.
Now,
Lawsuit.
exactly. And that's form of what? Being a safe nurse, right there. Now, that is one content under the NCLEX exam. That is also that is one concept, right, under the NCLEX exam, communication and
Right.
documentation. We have 6. I just mentioned one now. Now, take for instance right now that you perform a certain care, right, and you did not document the care, right? It's also going to be a big problem as well too. Now, let us say the particular activities you perform is administration of medication, right? And you should administer a certain medication by a specific time, but you fail to document that you have administered the medication. Guess what? What would the next nurse do? To give another medication again?
Medication, because you
Or
didn't
you
document it, so that
exactly.
person got double
All right.
medication. Right.
Okay. Now, if you notice, the first question we talked about is on advanced directive. The second question I talked about now is on what? Medication administration. And the both question is testing just one concept, which is communication and what? Documentation. You can see how NCLEX can test you within one of that concept related to different aspect of what? Client need. And that is the client need that we have here. We have 146 client need. NCLEX can just say, all right, let us test the students safety aspect within what? Communication and documentation. They have various ways they can test it, because you have what? 140 content that they can test related to what? Communication and documentation. Now, NCLEX can say, okay, let's test how she can work with what nursing process, and let's that because that is one of the concept. NCLEX can say, okay, let us see how she can let's test her clinical judgment. That is one of the concepts. NCLEX can say, let's test how she pay attention to a client's spiritual and cultural life or culture. And NCLEX can test something like that because that is part of what the concept. NCLEX can say, okay, let us see how she can teach and as well learn. Teaching and learning. That is one of the concepts. This is how NCLEX creates the question. So now we know where the content is coming from. We know how the NCLEX tests it. The content is coming from the 8 client need, and NCLEX will test you what related to concept, because that is how NCLEX tests to see you are a safe nurse. So now we have an idea of how the NCLEX can test it. So now what do we have to do now? We have to study the content, understand the concept, put them together, and use them to what? Break down our answer key, right? And be able to select answers correctly every time. Now, so we have the key to the NCLEX now. So what you need to pass the NCLEX exam is this. You need the NCLEX test plan, and you need what? The NCLEX pass question. Now, when a lot of students finish nursing school, the next thing they are looking for is what? A question bank, right?
Mhm.
Without no understanding the NCLEX exam. Now, this is
Right.
what I tell students like that. It's just like giving a patient medication without not knowing their diagnosis. Now, guess what? You are putting that patient at risk. So if you go on the NCLEX exam, right, without not knowing the content or understanding the NCLEX, guess what? You are putting your exam at risk. And the problem is this. A lot of students will go on the NCLEX exam expecting the question bank question to be on the exam, which is not possible because they can test a certain concept, a certain content that have been tested in a particular question bank, but the writing style will not be the same. NCLEX have a pattern for writing question. Most programs out there don't maintain this writing style or maintain the testing concept, because most programs don't even understand how the NCLEX work. They only understand how to distribute question. Now,
Mhm.
you don't want to answer 2,000 questions and still end up failing the exam. Instead, you want to know how the NCLEX write the question, right? And utilize that knowledge to be able to think as much as possible how the NCLEX can write your 85 to 150 question. But my goal for you is to pass the NCLEX exam what? In 85 question. This way,
Amen.
all we just need to cover, yeah, amen. All we just need to cover is what? The 5 key area, right? The 5 key area from the 8 client need, and then we just need to understand charts, bowtie, and then what? Case study. And
Mhm.
then you can easily pass the NCLEX exam 100% in 85 questions. Right. So the NCLEX test plan is very important, and I want to show you what is in it, right? So that we can get to like see it together. So I'm going to like stop this sharing.
Okay.
Okay, let me go, because if I switch, it's not going to share. So
Okay.
let me stop and then share it again. Can you see my screen?
I can.
All right, sound good. Now let me expand it. Now you have 85 to 150 question, right, for NCLEX-RN.
Yeah.
There's nothing bad in passing in 150 question or 85 question, right? The only thing is, if you see your particular um if you are taking the NCLEX exam and you start seeing 86 question, it means that you need more questions to show that you are what? A safe nurse. So just keep
Mhm.
showing the NCLEX that yes, I am a safe nurse, right?
Right.
So yes, that is it. Now, this is what you need to know. That is very important. This part. Now, I want you to tell me, uh, which area do you feel like you struggle with?
Pharmacology.
Pharmacology, okay.
Pharmacology and um I think maybe fundamental.
Okay.
But I really think pharmacology that's my weak. Medication, I just can't. Yeah.
Okay. All right. So when you were studying for the NCLEX exam,
Mm-hmm.
right, where did you pay attention to the most?
I think I paid more attention to management and care and not pharmacology, fundamental.
Okay.
I
That is
work in
the
L&D. I've been a PCT L&D for 13 years, so I worked in the hospital, and I think that's what made it hard too. You do what you see in the hospital and not the same when you do it on the test in I guess they say NCLEX world. So you have to get out of that what you see when you're working at the hospital to when you're
mm-hmm.
testing. Yeah.
You are right. Okay.
So
Yeah, you are right. So yes. Now, so far so good. You pay attention to fundamentals, right? Fundamentals can pretty much cover every area right here. Uh,
right,
right. But management of care, you paid attention to management of care and as well to pharmacology, and that give you what? 32% of the exam out of
right.
100%. Now, so if this, because so far so good, you did not mention safety and infection rate promotion, all this, right? Now, the problem is this: 32% is not enough
Mm-hmm.
for you to pass the NCLEX exam.
Right.
Right. Now, one thing I would say is that there's a possible chance you never had a clear path. You were just only maybe practicing question, and that was it. You were not studying with a certain plan, and that's why most of, let me say, the most important area you should be above the passing standard, you add near and below. Now, there's one thing I noticed about your test plan, right?
Mm-hmm.
You add near and below, but the only thing that I would say about the below, well, the areas you add below, right?
Mm-hmm.
Somewhere in the most important area and somewhere in the least important area. Now, this is what I call the top five. The top five is this: one, two, three, four, five. That's the top five. Now,
Mm-hmm.
all this area make up what? 27% of the exam. This top five area make up 73% of the exam. The moment you can have this 73% knowledge, right, together
Mm-hmm.
with charts, bow tie, case study, I can 100% guarantee you are going to pass the NCLEX exam. Now, this was
Okay.
it. Now, back 2 years back, when I was coaching students, I was just doing everything randomly, right? But later
Mm-hmm.
on, I started noticing something, right? Most
Mm-hmm.
people that come to me and they fail 7 times, 14 times, that's max I
Mm-hmm.
have seen. Someone even messaged me yesterday who failed the NCLEX exam 12 times, right?
Okay.
That's the highest I've seen in the maybe back 1 year back now, because the particular student who failed 14 times reached out to me. That was 1 year ago, and she
Mm-hmm.
passed on her 15 attempts. Now I'm trying to do this particular one with this other student now. So
Mm-hmm.
now, so far so good. I look at it from people who failed the NCLEX exam 5 times upward, right? And ask
Mm-hmm.
myself, what was I doing with this set of people that is helping them to pass the NCLEX exam
Right.
uh without no stress? So I gather everything all together,
Mm-hmm.
everything I've been doing, and I turned it into what? A step-by-step guide on how student can pass. Then I started using this with every student, and so far so good. People that follow that same approach end up passing the NCLEX exam, right? And I
Okay.
was like, okay, great. This is now a method. So since then,
Okay.
I've been going aggressive with it. I went on bootcamp group. I started messaging people personally because I wanted people to believe that they can pass. I was giving it to them, and every one of them were passing in 85 questions. And this was awesome. Then I said, okay, now I cannot make it a coaching program for a lot of people to have access to it and then be able to pass the exam. That is the reason why I can tell you strongly that you have the ability to pass. Right? I even had a particular student who struggled with English, and then she was still able to pass from Philippines after
Mm-hmm.
failing the NCLEX exam 3 times, right? And she gave up. I encouraged her not to give up. I told her the NCLEX exam is a test of concept, not English. So if you understand the concept, right,
Mm-hmm.
you are willing to become a nurse, you are definitely going to do it and you're going to pass. She took my word and then she passed the NCLEX exam in its 6 questions. So it's possible to pass the NCLEX exam, right?
Yeah.
Regardless
That's
of,
how I feel. I was like, I don't know. I've been praying and fasting. I'm from Jamaica.
okay,
So, I hear your accent. So I know you're African, some
yeah,
part. So we're all brothers and sisters and we believe
sure.
in the same belief. And,
Mm-hmm.
you know, and I've been praying and fasting. I was like, maybe God, this is not your portion. This is not what you want me to do. And then he turned around and said, if I put you through nursing school and you pass, then you could pass this test. Then I'm like, God, what am I doing wrong? And I'm sitting there giving up, and then I'm just scrolling through YouTube, and then you came up, and I started watching your videos. This was last night, and I started
Mm,
watching your video, and I was like, wait a minute now. No, it was Friday night, and I said, wait a minute, and I was like, okay. And something in my spirit was just like, just text him because I was on YouTube and I didn't see any number. And then I just went through the same Philippine person you said, and your number was there. And I was
mm,
like, okay, I'm going to reach out and see what this is about. Cause I was like, you know what? I'm just going to change my profession. I'm just tired. I'm discouraging. Every time you fail, it hurts so bad. And
mm-hmm,
everybody who you went to school with, they pass and they go on and they be like, oh, I did this and it's simple, and you sit and say, what is my problem? What am I doing wrong? I
mm,
study hard. I sit and I do what I'm supposed to do. I buy these programs, and it was like nothing is happening for me. I can't get it. And then when I sit and I do the question, I do good on the questions, and when I go
mm.
take the board, it's something different. So I'm
Yeah,
like, I don't know what it is. I'm hey.
yeah, I definitely understand, right?
I'm like, I don't know what to do. I'm like, God, only you know. I just leave it in your hands, and
Mm-hmm. Right. Yeah, definitely right. So, we thank God for that, and for sure,
yeah.
you after the whole coaching, definitely you are getting your license. I'm definitely walking you through this transformation, and for sure, you are
Amen.
definitely going to pass. Right.
Mhm.
So, yeah. One thing a lot of students do is that they pay attention to areas that are not that important on the NCLEX exam, right? Instead of the areas that are important. So I'm going to walk you through this important area,
Mhm.
right? Very much, and then you'll be able to achieve this 73% together with chart, both case study, and you are passing the NCLEX exam 100%. Now, one thing you also need to know about the this 8 client name is that, as I said, altogether they have what 146 content. Look at the content right there. If you go down the document, you are going to start seeing the content. The content are right there. So now, guess what? We now know the content that will be on the exam. Now,
Right.
the only thing that the NCLEX is not telling us is how the concept will be tested. But NCLEX explain each concept as well in this document. So immediately you can go through those concepts, right? You can easily know how each question will be written. And now, instead of even doing that stress, I've done the stress for you, right? Because I gathered every NCLEX past question and I tried to look at how the NCLEX write the question. And I noticed that when we always used to think like NCLEX have various way of writing this question, I analyzed 1,940 NCLEX past question, and I find out that NCLEX only writes the questions in 62 different ways. So now, meaning one way can be written to test maybe more than 10, 20, 30 content, but it's still the
Mhm.
same question. So if you
Right.
can understand the NCLEX question, know your content, then you have the ability to select the answer. Right.
Right.
That is the reason why most students will finish my program, they'll go on the NCLEX exam and they feel like it's another what practice test because they have everything they need to know before attempting the NCLEX exam. Right. So if you follow the approach, going through the content, each content, right? Everything out of the content. So if you see your question, there's no story again, like, oh, I don't know what the NCLEX is testing or something like that. This way, you go on the NCLEX exam, what you have clarity, you are confident, and then you are certain about any answer you are selecting. unlike before, whereby most students will go on the NCLEX exam. When they see the first question, immediately they feel like giving up because they are like, wow, I failed previously before, and now my first question, I don't even have an idea
That
about it.
happened to me
Right.
the last time I took it. The first question, I was like, what is this? And that just discouraged me so much. And I'm
Hmm.
like, oh my God. That
I'm tell
was,
I'm telling you the truth. Well, I've um most students have said the same thing to me as well. So, right, in a sense that when they say a particular question, right,
mhm,
uh they want to apply a certain strategy to it. But now when they don't know the question, so what will they do? They're unable to apply anything to it. And at the end of the day, guess what? They start second guessing themselves, doubting themselves, selecting wrong answer, and it become a problem.
right.
Right. Not even when most of them had a second chance. Because I always used to tell students, if your exam did not stop in 85 question and the NCLEX start giving you 86 question, it means that you could have either pass or fail, or probably even fail in 85 question, but NCLEX gave you second chance to like still show that what you are a safe nurse. And they
Right.
start giving you 86 question. At that point, if I was the one, I would take my time and I would like calm down and start rethinking through every question. But at that point, people start feeling, oh, why is my exam more than 85 questions? They get discouraged and they start answering question carelessly. And guess what? The end of it. A particular student failed the NCLEX exam in 87 question. Now,
Mhm.
in 87 question, let's do the analysis. Now, 85 question, it means that the particular student uh she was around the borderline, right? Now, if take Western baby she because for her to fail in 87 question, it means that NCLEX give her two more questions. Meaning if she had one correct and the other one wrong, then she will get what? 88 question, right? But it means that what happened is that, or maybe if she had the first one correct and the second one correct, she would have maybe stopped in 87 question and passed. But the reason why she failed in 87 questions is because obviously she had the 86 question wrong and the 87 question wrong. That's the main reason why I always used to I don't always used to look at your score. If I like maybe I'm testing you, I don't look at your score. Instead, I look at your the way you answer question in a row. Are you missing three questions before you get two questions correctly or something like that? Because if even if you want to have 3/5, right? I expect you to like maybe get the first one correct, maybe this wrong, this one correct, this wrong, and then the last one correct. Not getting the first one correct, getting two wrong in a row and something like that. Right. That is what I look at. To because that way I can easily tell how you are going to answer question on the NCLEX exam, right? In a way that you will constantly what be above the passing standard. Right.
Right.
Because there's one thing about getting two questions wrong. Right. On the NCLEX exam, if you get a particular question, obviously you don't know the question you are getting wrong, right? Some people can sense it based on the kind of question they're getting if it's so easy. Now, if you get a particular question wrong, NCLEX is going to drop the level of difficulty down. If you get the question wrong again, NCLEX is going to drop the level of difficulty down. But guess what? If you get the next question correctly, NCLEX is going to increase the level of difficulty, right? They
Mm.
are going to increase the level of difficulty even when you got two wrong. So if you get the other one correct again, the level of difficulty will be increased. So it will be difficult to like gain back these points if you are missing as a lot in a row, right? Instead, you get one incorrect, then the second question will boost you. Like if the second question drop in level of difficulty, get that correct so that at least you can get back that lost point. So this is what I like observe when I am coaching, like if you're answering questions, something like that, right? So that's the main reason why I give all the knowledge you need to answer a question, right? We know the eight client need, we know the content, we know the concept, we know how NCLEX test it. Now, the next thing I just need to do is to start showing you how you can walk through this process so that you can easily pass what the NCLEX exam, right? Easily. Now, um, I want to see how you approach questions on the NCLEX exam. Did you use the NCLEX past question when you were studying?
If I use the NCLEX past question,
Yes.
what do you mean? If I
Have you
use
seen
this
have you
test
seen
bank?
yeah,
No,
have you
I
seen this
never use
document before?
that. No. I always use like UWorld or Archer or Boot Camp as
Okay.
my test bank.
All right. Okay. Can you see the question on the screen?
Yes.
All right. Let me see how you approach question on the NCLEX exam. Try to answer this question. Read it out loud.
Okay, a charge nurse has received a change of shift report of the following client in labor. The charge nurse should ask a staff members to first see the client in the, okay, always start from the bottom to the top. Or, okay, the first one, the first stage of labor who has an oral temperature of 99.7. First stage of labor whose contraction is occurring every 30 seconds. Second stage of labor who has respiratory of 26. Second stage of labor who contraction are least listen for 60 seconds. So who would the charge nurse see? 99 temperature, that's not really a temperature, and that patient is kind of stable. The second stage of labor, 30 seconds. Contractions, first, that's the first stage of labor. Second stage of labor, respiratory 26. Um, I will go with I would say 3,
All right. Why is your answer 3?
because the respiration is so high, it's 26. And she's in the second stage of labor.
Okay. So what do you think the NCLEX is testing you?
Safety, who's the charge nurse gonna see first? Who's in like labor?
All right. Now,
Mm-hmm.
remember I said something. Every NCLEX question have 3 parts, right? The body,
Mm-hmm.
the stem, and
Mm-hmm.
then what? The answer keys.
Right.
Now, the first thing I want to identify in this question is my body. Now, the body of the question is just like a description or maybe like a scenario. It's not the question itself. Now, if you
Mm-hmm.
look at it now on the NCLEX exam, now, uh, the writer of the NCLEX exam, which you can see right here, the NCSBN, they write, so far so good, I know about 3 popular exam, right? They write the NCLEX, they write the NCLEX-RN, they write the NCLEX-PN, and they write the REX-PN.
Mm-hmm.
Now, but for the NCLEX RN and PN, when you answer your question, you are going to notice this particular symbol right there. Now, that symbol is trying to tell you that that is your what? Stem. This
Okay.
part is the body of your question, and then you have what? Your answer key. So you can easily identify the stem of your question, and you know the other one is the body of your question. Now, the body of your question is where what? The NCLEX put the content.
Mm-hmm.
Now, let me show you something so that you can understand what I am saying. Now, let me show you from the NCLEX test plan. Now, I want every student to be familiar with the test plan so that when they go on the NCLEX exam, they are not going to be lost. Now, when I read the body of this question, I can easily tell this body of the question is testing what? A particular content under ed promotion. Now, let's go under ed promotion real quick. Ed promotion. Now, can you see my screen?
Yes, I could see it.
All right. So look at what we have right here under it of promotion. Client in what? Labor.
Labor.
Now
Mm-hmm.
that is what under ed promotion content. Now go back to the NCLEX exam. Now see what the NCLEX is saying. The charge nurse has received a change of shift report on the following client in labor. Now guess what? Take for instance, right now, this particular question is the question that you maybe this was your first question on the NCLEX exam. Now, but previously, maybe 30 days ago, you were studying for the NCLEX exam and you've done all your studying on what? Client labor. You are going to see this question and
Mhm.
answer it successfully because you have already studied that particular content. Now, you are not lost in this particular question because the first thing you want to do is to identify the body of the question, which we did, right? The body of the question is testing us on what? Client labor, same as what we have what? On the NCLEX test plan, which has the content. Now, the next part is testing you on something. That is what we call the examiner question. Now, the
Mhm.
charge nurse should ask a staff member to first see the client in. So, NCLEX is testing you on client labor, and NCLEX is testing you to use what? The principle of what? Prioritization. Prioritization means what? Immediate attention. It means someone right here needs what? Immediate attention. Now, when you are working as a nurse, right, one thing you need to know is this: the kind of care you give is related to the particular settings that you are in. So there's no general care. Instead, there's what? Specific kind of care that you give related to what? The particular settings. Right. So yes, this is a prioritization question, but the way you are going to prioritize patients in medical surgical unit is different from the way you are going to prioritize patients in maternity or in
Mhm.
peds or maybe disaster patients or triage. You cannot utilize the same thing. So
Mhm.
prioritization is a general term, but prioritization can be specific to different things, right? We prioritize tasks to delegate. We prioritize a lot of things in nursing. We prioritize treatment. We prioritize procedure. We prioritize investigations. There are different way we prioritize, but that's uh who to see first type question is the most popular type of prioritization and the most challenging one, right? But despite the fact that the question is asking you who should you see first, you still need to understand the unit, right? Right now we are dealing with what? Maternity. So the way we prioritize patients in maternity is different from the way we prioritize patients in what? In peds. Now, take for instance, now you said the answer is 3. Take for instance, this is ped. Would that be correct for ped? Because obviously, maybe some people some certain age group have what respiratory rate to be as high as what 30 to 60,
30 to 60.
right? Now, so you can see the reason why when you are trying to prioritize on the NCLEX exam, you want to one understand the body of the question, understand what it's testing so that you can apply that specific knowledge. That's why I said earlier on when you were answering question on the NCLEX exam, you might just be applying what? A general knowledge to every question. Right. NCLEX is going to give you 85 different patients with different client need. Now you need to apply specific knowledge to each of what? Those 85 clients. And
Mhm.
what will give you the ability to apply that specific knowledge is when you understand what the NCLEX is testing. Starting with the body, client in labor, starting next to STEM, understanding it's a prioritization question, they will start
Mhm.
answering the question. Now, I
Mhm.
know various
So,
things that happen during labor, but I will limit my thinking to what the NCLEX is giving me. So I'm not going to ask myself, so each answer keys that is right here, what is the NCLEX testing me? I can see NCLEX want to test me on temperature. I can see NCLEX is wanting to test me on what? Contraction. I can see NCLEX is trying to test me on what? Respiration and as well contraction. Right. So now my general understanding about respiration, temperature is vital sign. So now I believe NCLEX is trying to test me related to what? Two things right here. So you can see as I am thinking, right? Because I understand the exam. The NCLEX is trying to test me to be a safe nurse. So this is what you are seeing. But what I am seeing is that NCLEX is trying to test me, test my knowledge related to contraction and what? Vital sign during labor. That's what the NCLEX is trying to test me. Simple. Now, I'm not going to think about it this way. I'm not going to ask myself, what do I know about contraction? Yes, one, I know contraction what have what? Frequency, and contraction have what? Duration. And I know there are various vital signs during labor. Like during labor, we want to pay attention to low blood pressure, want to pay attention to increased temperature, and then want to pay attention to low oxygen, right? Yeah. So now we want to also know that increased respiratory rate is what? Expected and not life-threatening. That is another thing. Because during second stage of labor, what is happening? Now, first stage of labor is when the mother is what? Having or contraction happen throughout labor, right? But that is when the mother starts with like dilation, right? All the way from when it starts from 0 centimeter all the way to what? 10
Mhm.
centimeter dilated. Now, the mother move next to what? Second stage of what? Labor. So second stage of labor is what? The betting stage. That is when the mother is going to push so hard. And guess what? That's take a lot of work. So guess what? Take for instance, you go to the gym right now. Guess what? You are going to be tired. Your respiratory rate is going to be high. If you go for mini jogging, guess what? What will happen? Your respiratory rate is going to be high. If you go for a walk, guess what? Your respiratory rate is going to be high. Does that mean you have a problem? No. Right. So same thing is happening as well to in second stage in labor, right? The
Mhm.
mother is trying to push. So that is using what? I what? Effort. And then guess what? The respiratory rate is expected to be high, right? That is the reason why
Yeah.
we do two things during second stage of labor. One, we give emotional care. Two, we help the mother with what? Encouraging her with what? Deep breathing techniques, right? Because of what? She's going to be having what? Increased what? Respiratory rate.
Yeah.
Right. So this is expected. Now, temperature on the other hand, right, is what? 97 to 100.4 degree Fahrenheit, and this is
Mhm.
within range. So this is also not bad. So now I have already clarified the vital sign. So I don't have any problem with vital sign no more. So now I'm now focusing on what? Contraction.
And I
Now,
was looking,
contraction
yeah.
all start from for frequency and duration. Frequency
Mhm.
means what? Every, and duration means lasting. Now, I'm
Mhm.
now going to ask myself, so which part of the contraction is the NCLEX testing me? Are they testing me on the every or the lasting? Now, right here, NCLEX is testing me on the every, NCLEX is testing me on the lasting. Right, so
Mhm.
every means frequency, lasting means duration. Every means frequency, lasting means duration. Remember that. Now,
Mhm.
so that is not how I'm going to attach the normal range. It's just like right now, if I ask you, what is the normal range for blood pressure? You will tell me 120 over 80. What
Mhm.
is the normal range for oxygen? You will tell me 95 to 100. That is the same way contraction for frequency, which also means every have normal range, and duration for lasting, which also duration, which also means lasting, have their own as well to normal range. Now, frequency all start. First stage of labor we have three phases. You know that,
Yes.
right? We have the latent, we have the active, and we have transition. Right. So latent, we have frequency and duration for each of them right here. Now, so for latent, it contraction start happening what? During the frequency, 5 to 30 minutes, 3 to 5, and then 2 to 3 minutes. So all these are all in minutes. But for duration, it all start from 30 to 45 seconds, 45 to 60 seconds, and then 60 to 90 seconds. So now I know the normal range, right? So I can now compare. Now, NCLEX is saying contraction occurring every 30 seconds. So I'm going to look at it and say, okay, frequency every, there's nothing like 30 seconds in my list. So it look like there's a serious problem right here with patient 2. But now let me look at contraction lasting for 60 seconds. Now let me look at my list. Right here, I can see 60 seconds here. I can see 60 seconds here. So it means that fall within range. So the duration is not a problem. Instead, the frequency is a problem. And that's a serious problem to who? The baby. Right. So the answer is what? Two. Is that clear?
True. Mhm.
Is that clear?
Yes, yes, yes.
All right, great. So that is how you think about the NCLEX. Now, what is making us to answer this question correctly is that one, we know what the NCLEX is testing, right? Two, we understand the NCLEX question and then we're able to break it down without you can see when I was answering this question, there was no aspect of me second guessing myself, doubting myself, because I follow a certain approach. So this approach, right, is what I want you to follow as well too, because I'm going to give you many of this approach. And when you go on the NCLEX exam, there will not be room for you to second guess yourself because you are following a pattern.
Right.
Just like right now, if maybe you stay at what Miami, and maybe I am in Naples, right? And I'm trying to locate you. If I have a map, when I don't even know the location, I will not be lost because I have a clear path. That is the same thing I want to give to you in this coaching program. Where I want to give you a map whereby when you see a particular question, you are not trying to think. Instead, you are just trying to like apply something to
Right.
it. The only thing you just need to do for yourself is to identify the content. The moment you can identify the content, you're always going to remember, and you are going to be like, oh, Favour said if I see this, this is what I need to apply. All you just need to do is apply it, and then you answer the question correctly. 85 questions, you pass the exam, and then you have a testimony for me. Right. So that is
Amen.
everything. That is everything I will just say for now, right? So now what we
Right.
just need to work on is identifying the content, knowing how to answer the question so that we are clear on answering the question. And for sure, I have no doubt, yes, you are definitely going to pass the exam. So at this point, I want to ask you that
Hmm.
you need to be committed, right, to
Yes.
the program, right? So you need to be
Yes.
committed. Have you scheduled your exam? No. Yes.
No, actually, I got my ATT, so I have till the end of August. I didn't know. I guess they changed it. Now they give
Okay.
you, after you get it, you get at least 3 months.
Mm.
So, yeah, I didn't schedule yet, but I got my AT, so I could schedule it anytime.
All right, sound good. Right. So let us start with understanding the NCLEX, like the content first. So
Right.
build on the content because my coaching program is for what? 8 weeks, right?
Hmm.
The first 4 weeks is for content. This next 2 weeks, right? The 4 weeks I do what? Content, right? 2 weeks for question, and then the last 2 weeks for strategy. Right, the last 2 weeks for strategy. Right. So this way, if we start with the content, you answer question, I expect you to meet what 60 to 90% pass rate. If you meet this pass rate, I believe you can use content to pass on the NCLEX exam. But I will try to like increase your like chance of passing the NCLEX exam by giving you all the strategy I know. That's
Right.
then when you answer question, you should be within 75 to 95% pass rate. Now, if you are within this pass rate, I can tell you 100% you are definitely going to what? Pass the exam.